Hello and welcome to this edition of the news. I'm Rukma and our top story. A number of landmark decisions were taken today at a meeting called by Home Minister Amit Shah to help national capital Delhi tide over the corona crisis. Testing will be doubled in the next 2 days, and in 6 days it will be increased by 3 times. Testing will be conducted at every polling booth in containment zones. In order to intensify contact tracing in the containment zones, every person in the zone will be tested. Health will be screened. Health of every person in the containment zone will be monitored in order to augment scarcity of beds in hospitals, railways to provide 500 coaches to Delhi. This will augment the number of beds to 8,000 here. These coaches will be equipped with all facilities to treat COVID patients. All private hospitals to keep 60% beds for concessional rates. Government of India assures Delhi of adequate supply of oxygen cylinders and ventilators, pulse oximeter and other equipment. And Arun Sharma now joins us with more information on this. Well, Arun, a number of landmark decisions taken addressing the issues of all Delhiites, of all residents and those within the National Capital Region. Take us through them once again.
Well, Rukma, Home Minister Amit Shah is known for his quick decision-making approach. Amit Shah, the Home Minister, is known for out-of-the-box ideas and out-of-the-box approach. So that's what happened today when the Delhi Chief Minister, the LG, and the various other stakeholders of Delhi government, and of course Home Minister Amit Shah met today. Well, landmark decisions were taken today in order to control the COVID crisis as of now. The important part, well, we know this fact that Delhi government seemed to be on back foot as far as the bedding capacities are concerned. So in order to increase the bedding capacity, important decision was taken to hand over 500 railway coaches to the Delhi government so that the bedding capacity can be increased by 8,000 beds as of now. So now, in last 24 hours, we can say that the bedding capacity in Delhi has been increased by 13,000 because Delhi government has also taken a decision to convert the multi-speciality hospital, the small and the medium multi-speciality hospital into the COVID hospitals which are having beds from 10 to 49 beds which are having. So by this decision of Delhi government, 5,000 beds will be created in order to treat COVID patients. So in all, in last 24 hours, 13,000 beds or the bedding capacity has been created. That's number one. Second important part is about contact mapping and contact tracing. So yes, the contact mapping will be done, contact tracing will be done. As far as in containment zones are concerned, the focus will be on as to how can each and every family member of people who are living in containment zone, they can be traced, their health checkup can be done, the health survey can be done, of which the report will be provided to them in 1 week's time. So in this order, the focus is completely on contact mapping, contact tracing, so that the tracing can be done properly. Third important part, Rukma, it's very important, and that is of testing capacity. Supreme Court, pulled up Delhi government for mismanagement of COVID crisis, and also because of the reason that the Delhi government, primarily Delhi, witnessed a decrease in the testing rates. The Supreme Court observed that the testing has come down from 7,000 tests per day to 5,000 tests. So this was something which was noteworthy as far as Supreme Court's observation was concerned, and the Delhi government was pulled up by the Supreme Court for the same. So now the focus in Delhi is to increase or to step up the testing facilities in Delhi. So yes, in next 2 days, the testing capacity will be doubled. And in next 6 days, the testing capacity will be, tripled going forward. And the focus as of now is to create the testing centers at the polling booth level in the containment zone. So all in all, the focus is on how to increase the testing capacity. And that was the major cause of concern for many Delhiites, many people in Delhi, that the testing is getting decreased. The Supreme Court also, pulled up the Delhi government for the same. So now the good news is that it's a big news and it's very very good news that the testing capacity in Delhi will be increased going forward. So yes, the doubling of the testing rate, the testing capacity in next 2 days, and it will be tripled in next 6 days going forward. So that's an important part. The important part, another Rukma, is that about the guidance. Most of the people get panicked, talking about COVID crisis. Even if they are having minor cold or cough or even sore throat because of the seasonal changes, they are also getting panicked that exactly what should they do. And if somebody is testing positive, or if somebody is getting symptoms of COVID, they are actually getting panicked. So what government has done as of now, the big decision by the Home Minister Amit Shah is that the AIIMS guidance facility will be opened up. The helpline number will be opened up soon. The number will come up soon. So if anybody, any Delhiite or anybody who's living in Delhi is having some COVID symptom, if any symptom is there, and if some kind of guidance is required, they can directly contact the expert committee, the specialist in this field, and they can talk to them, and they can of course solve their problem as far as the guidance is concerned. So yes, AIIMS has come up now. The AIIMS will be guiding you directly if in case there is some kind of doubts in your mind as far as the COVID is concerned. Yes, the AIIMS guidance helpline number or phone line number will be out soon, and you can take guidance from the doctors and medical fraternity who can guide you as far as the COVID is concerned. Last but not the least, important decision is about the rates and the pricing. The VK Paul, the member Niti Aayog, and he is also expert in the medical fraternity, he's been given charge to find out ways as to how can the rates be chalked out as far as the Delhi hospitals are concerned. So yes, the important part is that 60%, I mean the private, if you talk about the private hospitals, 60% of beds in private hospitals in Delhi, the private hospitals have been given directions to treat the patients and to provide them the bedding facility at the affordable rate. Now this direction has been given to private hospital, and that the treatment and testing should be done at the affordable rate. And VK Paul has been given charge to come out with a report by tomorrow as to what can be the testing rates, the affordable testing rates, the affordable treatment rate in Delhi. So it is a major problem for Delhiites, because we saw this fact that various private players, private hospitals were charging exorbitantly as far as the COVID treatment is concerned. So by this move, the 60% of beds are primarily in the private hospitals, these 60% beds will be providing treatment at the affordable rate, and the testing and the treatment rate will be out soon, because VK Paul is being given the charge to come out with the rates at what can be the treatment and the testing rates going forward. So that's an important part. So these are some of the major highlights that were discussed during this meeting, and the major decisions have been taken going forward in order to control COVID crisis, Rukma.
Right, also new directions for containment zones as well. Arun, when we talk about, screening of containment zones, that's a big major decision. That's a very big step, because it would cover a huge number of people who otherwise may not have gone in for testing at all.
That's right. As I said earlier, Rukma, that testing was something which was major cause of concern for the people of Delhi, because they were looking for testing, they were going for testing, but they were denied testing. But there were many cases in Delhi who were having symptoms, they were approaching the doctor, but their testing was not recommended to them. But now, as the government has come forward, and as the Home Minister Amit Shah has clearly said that testing will be stepped up going forward. So that we know this fact that testing will be doubled in next 2 days only, and it will be tripled in next 6 days. But important part is that the testing facilities will be created at all the polling booths in the containment zone, at the polling level, at the polling booth level in the containment zones. So we know this fact that there are many containment zones as far as Delhi is concerned. So there were cause of concern that how can testing be done. So by this move of the government, more and more testings will be done, and yes, testing will come to the people. That means at the polling booth level only, people will be in a position to find the testing center so they can get tested in the containment zones also. So important part is that there were people in Delhi who were going to private labs, who were going to the government hospitals. They had to queue up in the private hospitals and the government hospitals. So now the testing, as the government has stepped up testing in Delhi, so that load will come down as far as testing is concerned. And yes, more and more tests will be done. So now the testing centers will be created, the testing facilities will be there at the polling booth level, so that in the containment zone. So if in case somebody wants to get tested, if there are symptoms to some person who wants to get tested, they finally can get tested as far as these polling booths are concerned. So that's an important part. But also something which is noteworthy, Rukma, there were families, there were people who were complaining about the fact that those who have lost their near and dear ones, those who have lost their family members, their bodies were not given on time. There were some kind of delays because of the medical procedure in that part. So government has announced that they'll be coming out, they'll be revising the last right policy, and of course the new guidelines will come in place so that the people who have lost their near and dear one, who have lost their loved one, they'll get the body of their family members soon. So this will increase this will primarily decrease the time in getting the body of their loved ones who have lost their life in this time of COVID or the coronavirus. So that's an important part. And of course something which Delhi government was worried about, how to get more and more health infrastructure like oxygen cylinders, oximeters, pulse meter. So the central government has given a clear instruction, and of course they have ensured and they have clearly assured the Delhi government that all the health infrastructure which is required in fight against COVID, like the oxygen cylinders, pulse meter, oximeter, beds and everything, this will be provided to the Delhi government. And yes, the central government officials will also be observing and monitoring the situation, so that whatever decisions are being taken as of now do reach the people in Delhi. So yes, it's a big move by the government, and as I said earlier, that there was a requirement for a coordinated effort. So now it's a cooperative federalism kind of move, whereby the Delhi government and center coming together to fight against COVID. As far as Delhi is concerned, Delhi was majorly impacted by the COVID crisis. We have seen this fact that the number of cases were increasing exorbitantly. We have seen in last couple of days more than 2,000 cases we have seen in 24 hours, and the number of deaths were also increasing day by day. So this move of course will play an important role and significant role in controlling the number of cases, the active cases primarily. So that was the move, and yes, it's a complete and clear example of the cooperative federalism, whereby states and center, they both have come together to fight against COVID in Delhi. Rukma?
Right, Arun, thank you very much for joining us there. And well, also Arun, we